and we will share it on Workplace. While our presenter and our reactors are speaking, we will have your lines muted to reduce unnecessary noise, but we will unmute at the end of the presentations for questions and comments. However, if you do have questions and comments that you don't want to forget or you feel you want to put out right away, please feel free to use the chat box all the way through. We'll be taking comments both aloud from the audience and also through the chat box. I think that's all we have for logistics, so I will turn this over to our moderator, Dr. Lisa Letourneau. Lisa?
Great, super. Thank you, Callie, and thanks everybody for joining. We're very happy to have folks on the phone today and a great set of both presenters and panel reactors. So with that, I'll get right to it. I'm very pleased to introduce Dr. LouAnne Giangreco. Dr. Giangreco is the Vice President and Chief Medical Officer of Healthcare Improvement at Excellus Blue Cross Blue Shield in New York State, one of the largest health plans in state New York. Dr. Giangreco received her doctorate from Albany Medical College and her residency in emergency medicine at SUNY Upstate. She's served over 15 years in various quality and administrative roles, including serving as Chief Quality Officer, Assistant Medical Director, and Chief Medical Officer in several New York hospitals, emergency medicine and urgent care practice before joining Excellus. We were very pleased to hear about the work that Excellus has been doing over the past several years, incorporating Choosing Wisely into some of their improvement and even payment plans, and so we're extremely pleased to have her here with us today. Welcome, Dr. Giangreco.
Thank you, Lisa. It's a great opportunity to be here talking with you about the work that we have been doing over the years with Excellus. One thing I just wanted to call out as we get started is, as Lisa had mentioned, this has really been an initiative over many years, and there's been a number of people on the team that have been a part of this work. So some are still with Excellus, some have moved on to other opportunities as well, but there's been some great foundational work and some people who continue on the team, like Diane Burden and Marla Miller, who have done some great work in moving it forward. So thank you to all the people who have really laid this foundation and made this work possible here with our organization. So in taking you through the agenda, I'm going to give you a little bit of history about Choosing Wisely here at Excellus, including how it aligned with our strategy and our mission. We're going to talk about how we utilize data to support Choosing Wisely, how we've been able to incorporate Choosing Wisely into existing programming, and we're going to talk about where we stand right now with Choosing Wisely and the role of the health waste calculator in the work that we're doing and some of the work that we have planned for the future as well. So in giving you a little bit of the background of the history of Choosing Wisely at Excellus, we really found that it had a natural synergy with the work that we're doing. So it's aligned with our organizational mission, which is to help people in our communities live healthier and more secure lives through access to high quality and affordable health care. So we're a non-profit health plan here in upstate New York. And so it was really something that we wanted to move forward to really help our communities as well as just our membership. So we utilize what's called a 7-block strategy here to guide our work in the organization, and Choosing Wisely really aligned with what our strategy is, so to improve our member and community health while reducing cost. And we really want to make sure we're empowering our members through shared decision making. Our senior leadership support and commitment was really key in helping to move forward with this work. It was an innovative approach that the team had taken when it first started, and that was critical in moving the work forward. Some other key elements were that Choosing Wisely was really aligned with what's important to us in that it was physician-led and patient-centric. So we really want to make sure that we're supporting shared decision-making tools within our membership, and Choosing Wisely is clearly a great tool for that. And as we continue to move forward with our work, building upon that foundation of value, as we move towards more and more value-based arrangements, it's really key that we look at both cost and quality. And I'll be able to show you a little bit of how we've been able to do that through our work. So health plans really utilize a population health management strategy to improve the health and well-being of our members. we have a broad reach across New York. So we're able to reach up into the upper portions of upstate New York, down into the southern tier as well. So we're able to touch a number of members and providers across the state. And that really allows us to partner across the community. So with our role with that, we saw that there was an opportunity to focus in 4 main areas. We wanted to educate, promote, partner, measure, and report. So with education, when the campaign initially started within the community, there were several providers who had still not heard of Choosing Wisely, so there was an opportunity as the health plan to go out and really serve as Choosing Wisely ambassadors. So there was education that happened internally and externally about, what is it and how we can use this. And there was really a lot of enthusiasm and energy as different teams learned more about the foundation of Choosing Wisely. We saw it as an opportunity to promote as well. So it was really an opportunity to share the importance of us of being patient-centric. So we were able to share in some key concepts of shared decision-making, the importance of patient safety, and waste reduction as well. We were able to partner in new and different ways. So we really wanted to make sure this wasn't about Excellus or the health plan. It's really about physicians and patients, and we really saw it as a unique opportunity to bring that message forward. And again, as we had mentioned, that measurement's really that foundation of the work. It allows us to have some communication. We have the opportunity, we have a lot of information in our claims data that we're able to share in meaningful ways. So, as I had mentioned, measurement's really that foundation of our work. So it gave us an opportunity to look into our database and identify some opportunities. So, Choosing Wisely has hundreds of great recommendations, but we really needed to start to focus where we were going to put our efforts to make sure that we were successful. We know that sharing data is important to being successful as well, and if a picture is worth 1,000 words, a graph also is. So we were able to share some graphic information with our accountable care organizations in regards to some of the costs associated with waste. And we were able to track our progress over the years as well, both at a individual accountable care organization level, at a provider level, and as the health plan as well. So in our industry, we work with claims data. And so claims data has some benefits, and it also has some challenges as well. So one of the benefits of claims data is that it follows patients across different providers and delivery systems. So if you're working with a particular hospital system, you're not going to know if a patient goes across town, but within our claims data, we're able to see when people have sought care in different systems. There are also some challenges with claims data. So, claims data isn't a medical record, so we're not able to see some of the details that may be documented within the chart. Things like the headache was the worst headache of somebody's life, which can be a challenge. Also, if a member is new to our plan, we're not going to have information about some of the past medical care they've had, so we may not know that they've had a colonoscopy recently when in fact they did. And there's also some limitations from a data integrity perspective as well. So if there are issues with coding accuracy, we will have some challenges in what we're able to gather. That being said, one of the key factors is that we need to be transparent and that it does have benefits and it has challenges as well, and we share that with our provider partners. So we do tell them that not to expect perfection in the data, and with that, we're not trying to be exact. We're giving different ranges, and we're also pointing out where there may be opportunities for providers to go back and look within their own EMR and do a deeper dive to figure out the why behind what they're seeing. So as the program was developed, there were 6 priority areas that were chosen based upon the claims experience. And, we felt these were high areas of impact. So these were elective C-sections, DEXA scans, imaging for headaches and low back pain, colorectal screening, and vitamin D testing as well. So early on with the Choosing Wisely campaign, we speculated that our accountable care organizations would be a great opportunity to socialize these measures. They have both the cost and the quality perspective that they're looking at. They're looking at things like unwarranted variation and waste as well. And the fact that this is Choosing Wisely is a physician-led campaign really added credibility to the program also. We also knew early on that this campaign was different than what's been done in the past. And we really wanted to make sure we took that spirit of choosing wisely. We didn't want this to be something that the insurance company was imposing upon people. It really needed to be owned and led by the physicians as well, and a part of the work that we already do. So where did we decide to leverage this information? So we decided to leverage some of our existing resources that we have as well. We all know that there's not one solution that helps us to drive the work forward in the quality and value arena, that it's really a multifaceted approach that helps us to drive the work. So we were able to integrate Choosing Wisely into some of our existing programming as well. And one of the key call-outs is that we sometimes hear from our quality partners that there's some improvement fatigue. There's a lot of different entities that are putting requirements on what needs to be improved. And when everything is important, nothing is important. So we really wanted to make sure we weren't adding on anything extra, that we were doing this as part of the existing programs as well. So some of these call-outs of our programs will go into a little bit more detail. We have a really active corporate communication department that works closely with our quality department. So member community outreach was really key in utilizing that team. We wanted to look at both the ambulatory setting and the hospital setting. So we looked at our hospital performance incentive program as well as our ACOs, which we call our accountable cost and quality arrangements, and really how do we outreach to our providers across these settings. So these are a couple of the examples of the posters and communication materials that have come out from our Choosing Wisely initiative. They're really eye-catching. They have some key information, facts, and figures for individuals within the community to be able to take a look at and understand. These posters are utilized for media campaigns throughout the year as well. They've been included in member newsletters. They've been used with employer groups. We also have our provider relations team that goes out to our provider offices with different posters. They're available on our website. So they really are there to get our providers and our patients talking about these key initiatives. This year we've had a very active media campaign as well, and have had some media spots in the past. So this year we had TV spots and social media campaigns that touched on topics that included early elective deliveries, colorectal screening, antibiotic use, low back pain. We have blogs as well. We use our social media feeds like Twitter and Facebook to share this information with our members. And then we have our accountable cost and quality arrangements. So these are our value-based payment arrangements with our ACOs, and we have 8 Aqua providers for our commercial line of business. We also have some systems that participate in our Medicare and Medicaid Aquas as well. And there was really a clear synergy between the Aqua programs and Choosing Wisely. The idea of shared decision-making tool that's bringing together physicians and patients in care. There's opportunity to reduce waste, to improve health outcomes, and improve the quality of care for our populations of patients. So we really wanted to emphasize that importance of increasing value by increasing coordination, improving quality of our populations, and really aligning payment with quality, patient outcomes, and value in this space. So the work really moved forward with a simple approach. They started the work with sharing some data and presented it as really an opportunity analysis. The top 6 measures were prioritized. These had the highest associated cost of the 20+ measures and were really seen as the greatest potential cost savings if improvements were made. We had physician attribution for our commercial membership in these accountable care organizations as well. So through our Aqua partners, we knew that we could reach over 1,100 PCPs with more than 500,000 of our members. So Marla Miller on our team was really able to develop this reporting. The reporting was then integrated into these quarterly reporting packets that the health plans supplied to our accountable care organization partners. And so when the ACO started to see this Choosing Wisely tab in their reports, they began to ask some questions. And it really moved the conversations forward. There's a lot of enthusiasm and excitement, and the data really helped to drive their engagement in the program and see the benefit of integrating Choosing Wisely into their practices as well. And so these efforts were really supported by our internal health plan interest as well. Our ACO newsletter helped to promote the recommendations and to project the cost savings among our ACO partners. And it ended up happening with some planning and some chance, but it really allowed the work to grow. There was also the development of a provider resource guide and toolkit that the team was very proactive about, because the team really saw it as an opportunity to help physicians and groups get organized, as well as helping to facilitate some of the necessary changes in the culture-based principles of shared decision-making. It was modeled after the work in Washington State, but it was modified and personalized to meet the needs of our particular network here in upstate New York. So the work has continued to evolve over time with input from our physician partners, and that evolution with their input has allowed for physicians to accept our support as they were able to see some practice variation and opportunities through the measures themselves. So as the work progressed, we continue to provide those accountable care organization or Aqua data reports over time. And our reports were able to provide data at both the group and the provider level. We're also able to provide data about the Excellus population as a whole. So the ACO is really able to create a strategy in looking at the provider level, at their ACO level, and where they compare to the Excellus population to decide where they're going to develop their focus. We also deliver rates in our ACO space as well. As we talk with our hospital partners, we tend to go more towards percentiles, but we do present rates and cost to our ACOs. We also create a tiered savings approach to our partners as well to help them set some meaningful targets. Again, we know there are some limitations in the claims data, that it's not perfect, and this tiered savings approach takes that into consideration as they decide to put their focus into place. We also provide a list of those providers within the ACO that are the negative outliers, and this really allows our ACO partners to do a deeper dive into their clinical data resources with their EMR, for example, to figure out the why. Again, this is not meant to be punitive out there. There may be a particular reason that a particular provider is different than others. There could be an element of warranted variation, but we partner with our providers to give them the data to help them do that deeper dive and to really start to ask questions and have conversations within their practice. So here's a couple of examples of our Aqua rates and savings reports as well. So we're able to see over time if there's any changes. So we did, as I had mentioned, we delineate rates for these measures. Again, we're basing these upon the Choosing Wisely initiatives. We look at our denominator, so we end up calling out things like office visits, ED visits, and urgent care visits, as well with a primary diagnosis of abdominal pain or tenderness. And for our numerator, so for example, for the abdominal pain measure, we're looking at the number of visits followed by an abdominal or pelvic CT within 30 days. And then we call out that savings opportunity. So for example, for this sample Aqua, for the abdominal pelvic CT measure, if they were to create a program to decrease waste by just 10% in this area, they could potentially save over $170,000.
Of patients for whom a visit occurred within 30 days.
So we're also able to provide comparison data and some practice variation as well. So as I had mentioned before, we do compare to the health plan as a whole, knowing that we do have some limitations with claims data. So this, for example, shows that Aqua X is generally above average in their performance, but where they fall a little bit short of the remainder of the Excellus health plan population is with the vitamin D testing. So their rate is 9.5%. The overall rate for Excellus is 5.8, so that may be something to consider. They may want to do an initiative in that space. In addition, we're able to show that providers are sometimes outliers as well. And again, this is to trigger a conversation at the Aqua level to find out why. There could be something warranted that's leading to that outlier. We do list the numerator and denominator, so there could be a low denominator that's leading to that difference. And really, we're setting the data out there to allow them to do a deeper dive into that clinical data and figure out why there's some variation as well. And as we've evolved over time, had conversations with our providers in different spaces, they've been able to help us to further refine our methodology as well. So we've had some great conversations, for example, with our ED providers, and have been able to dig in deeper and figure out how we may want to change our methodology for the future. So we also work within the hospital space. So we have what's called a Hospital Performance Incentive Program, which is our HPIP program. It's a pay-for-performance program for hospitals. So we currently have 30 hospitals that are participating in the program, and it's a program that offers our hospitals additional funding above and beyond what they have through their traditional contracts. It's a program that was established in 2004 to align with the health plan and hospitals' need to increase quality and safety. And the program has evolved and continues to evolve over time. So choosing wisely was a natural synergy to this program. It combines the concepts of quality and cost to discuss value in this hospital space. So for our hospital partners, we decided to create a measurement system that was aligned with some of their quality measurement methodology, looking at some baseline rates, percentiles, and targets as well. So we present the data from the quality perspective versus the cost perspective that we do in the Aqua arrangement. It's a little bit different than our ACO strategy, and it's likely to evolve over time as we continue to work in this space. So we provide our hospitals with a grid of different data, and here I just pulled out the measures that are related to choosing wisely. So we do have some measures that are choosing wisely only measures involving imaging for things like headache, CT, or head injury, and syncope. In addition, we have some measures that are both aligned with HEDIS as well as choosing wisely. So for these measures, we've looked internally and developed our choosing wisely specifications as well as some HEDIS specifications. Both have some benefits and challenges, and as we continue to move forward with this work, we're looking forward to having some help from the health waste calculator to help us further delineate what we're looking for in this space. So as our teams have worked in this space, have found it really aligns well with our programs, that it's helping to drive the meaningful work forward in the value space. We knew that we wanted to continue our work, and our internal team did a fantastic job of really operationalizing the methodology and reporting. However, they also have a number of other key responsibilities in the health plan. So as we continue to evolve the work, we knew there was an opportunity for partnership. So we decided to turn to our partners at Milliman to help us further in this space. So now we've started to partner with the Milliman Health Waste Calculator to further help us in this value proposition. So Milliman also uses claims data. They're a turnkey solution, and it's one of a number of tools that they offer. And by using Milliman, it helped to increase the number of measures we were able to look at as well. So the current version that we're using utilizes 42 measures. They continue to grow as well. So it utilizes evidence-based guidelines that are prioritized and defined by leading organizations like Choosing Wisely, but also uses input from the USPSTF as well. So the Health Waste Calculator has been able to expand some of our look-back periods as well, and they have a great conservative definition of what's waste and have some well-vetted definitions as well. So we really found it a great synergy with the programs that we're looking at. So Milliman, again, they continue to add more and more measures into different spaces. There's a lot of different measures in the primary care space, but there's also opportunities to impact across specialties as we continue to look at our work and how do we create more value-based programs within the specialty-based arena. There's also measures that hit in different areas as well. So things like testing and treatments, diagnostic approach as well. So making sure that we're getting measures across a different spectrum. Flexibility in reporting was important to us as well, and we wanted to make sure the data was presented in a way that's easy to understand for our partners. So we were impressed that the data could be presented in a variety of different reports. So as we're working with different audiences, we're working with providers versus administrators versus a quality team, we're able to present the data in a way that's meaningful to them. The data also helps our provider partners to prioritize as well. So they use that Pareto approach. So on the sample, you can see if you improve these 3 measures, that you'll be impacting 55.2% of the identified waste instead of trying to tackle 42 measures. So going back to the idea of improvement fatigue, we wanted to make sure that we're providing our provider partners with tools that are meaningful, that allow them to focus their initiatives so that they can have success. So we're now looking at how we can construct our next generation of reports for our accountable care organization or Aqua partners. And so this is an example of a sample report for an ACO from the waste calculator. And it really helps us to show them where there may be the greatest opportunities. It helps to provide that focus. We can provide the reports in a variety of formats, as I previously called out, and here's just 2 samples of those. We really also wanted to make sure that we're aligning choosing wisely messages with our quality messages as well. So for example, there are some areas in cervical cancer screening where we still have significant gaps in care with our population. So there's still members that we have that aren't getting their cervical cancer screening. And then we have people who are having wasteful over-testing as well. So we want to make sure that as we continue to empower our provider partners with this information, that we're helping to emphasize what's best practice in the space to ensure that all of our patients have that just perfect, that needed level of testing as well. Also, as we move forward with choosing wisely in the waste calculator, we're continuing to learn from what worked well with us in the past. So we're continuing to leverage key priorities within the national, state, and local medical communities. We want to make sure we're aligning with our internal programming as well. We want to make sure that we're creating a program that will be our cost savings for our provider partners. And we also want to make sure that we're improving our quality performance and that of our providers as well. So with that being said, we started to do a deeper dive into how we can partner with the provider community in regards to antibiotic stewardship. So there are a number of measures within the health waste calculator that touch on this area. They include things related to antibiotic use in patients with upper respiratory infections and ear infections, antibiotics for adenoviral conjunctivitis, oral antibiotics for patients with otitis externa. So when we look across our whole organization, it wasn't the area with the highest amount of waste, but it had the ability to impact and align with a number of different areas. So we decided to do a deeper dive into this. Choosing wisely has great supports for our patients and providers in this space too. There are a number of recommendations related to antibiotic use. There's the shared decision-making tool for our patients, including the 5 questions to ask before receiving an antibiotic. The health waste calculator also provides information to our clients on the background of the measure, and that's delineated up here on the slide. We also know there are a number of national and state priorities in this area and great information that goes with that. They have great evidence-based guidelines. So for example, the CDC has the antibiotic stewardship program guidelines in a fantastic format that's easy to implement in both the inpatient and outpatient settings. The New York State Department of Health has an antibiotic stewardship task force that has created antibiotic prescribing guideline pocket cards, as well as a number of additional materials that you're able to order for free right from their website, including viral prescription pads to help empower patients in self-care in this area. We also know from the quality perspective there's a number of HEDIS measures that relate to the judicious use of antibiotics, including antibiotic avoidance in URI and bronchitis, testing before treating in pharyngitis, and overall utilization. We also knew there was some opportunity to make an impact on adverse drug events related to antibiotic use. So 1 in 5 visits to the ED are related to adverse drug events are related to antibiotic use. We also know that there's an ability to impact other conditions like C. difficile colitis. So back in our hospital performance program, we do look at hospital-acquired infections, so there's a direct linkage back to that program as well. So we really saw antibiotic stewardship as a project to move forward with. It had great evidence-based resource, it has great tools, great alignment across our different programs. It's really an opportunity to go back to our mission and our strategy to improve the health and well-being of our members. So here's a couple of sample health waste calculator reports for antibiotic stewardship. So these are just 2 examples. So the one to the left is related to the per provider prescribing of wasteful antibiotics. So again, our ACO partners are able to do that deeper dive into where they may want to have conversations and look into the EMR. And we're also able to look at some of the antibiotic utilization and where we may be seeing waste also. Again, we understand the limitations of claims data. It's just really an opportunity to ask why and go a little bit further with the work. So we have a number of other potential improvement projects utilizing both the health waste calculator and choosing wisely. We want to continue to find areas for meaningful and significant opportunity. We want to find alignment with already existing internal and external programs. So we have explored and may move forward with some programs related to testing. These include things like pre-op labs, EKG screenings, and imaging for headache and syncope. And we want to make sure we're continuing with that philosophy of choosing wisely that we started with, and really that intent to be patient-centric and physician-led. We're not utilizing these programs to create policies or prior auth programs. We're really here as partners in the community for population health. We want to be able to provide data in meaningful ways and help to reduce barriers to the community so they're able to provide high-value care. We're able to find and pull together resources in a different way, fitting where we do within the community, and we really just want to make sure we're making those connections to other programs and taking care of the people that take care of our members. So with that, I will thank you for inviting me to speak today in the Choosing Wisely group. It's really been a great honor, and I'll turn things back to Lisa.
Impressive, LouAnne, and I just think even so I was had the very good fortune to be at Excellus last April and had a chance to learn about your activities then, but I was just sitting here shaking my head thinking, oh my God, this is even more than I ever realized. So really impressive. What a fantastic amount of work that you all are doing. We do have several questions that have come through the chat. But we're going to, if people don't mind, hold on to those because we have 2 esteemed reactors here, so we'd love to have them offer their comments first, if that would be okay. So if folks can just hold on, we'll get to those questions both in the chat and then open up the mics as well for more questions at the end. So again, with huge thanks to Dr. Giangreco, I want to move on to our 2 reactors. So we have Dr. Reshma Gupta and Daniel Wilson from the Abim Foundation. I'm going to just do a brief introduction for both, and then I'm going to turn to Dr. Gupta first for some of her thoughts and maybe questions as well. So first, Dr. Reshma Gupta is the Medical Director of Quality and Value at UCLA Health within the Office of Population Health and Accountable Care. She's a physician lead for their quality and value data analytics team and their value-related efforts through all clinical divisions of their faculty practice group and shared savings programs. She previously was a Robert Wood Johnson Clinical Scholar at UCLA, a very esteemed position, so congratulations on that, and Chief Resident at the University of Washington after receiving her medical degree at UCSF and Master's in Health Policy. and Management at UCLA. Additionally, we have Dan Wilson. Daniel is the Executive Vice President and COO of the Abim Foundation. He previously served as the founding president and CEO of the Alliance of Community Health Plans. During his tenure there, he earned national recognition for spearheading the development of the HEDIS data set and convening the RX Health Value Coalition to provide independent information on the pharmaceutical industry. Also co-sponsored with the American College of Physicians, the journal Effective Clinical Practice. He's received his master's in Health Services Administration from the University of Michigan School of Public Health. So again, thanks to both of you for joining as reactors. And I wanted to first invite Reshma to make her comments. Dr. Gupta.
All right, thank you so much. Can you all hear me okay?
We can, thank you.
Okay, great. So that was just, I wanted to thank you so much just for a wonderful presentation. Really enjoyed the talk and really impressed by the work. I think what really catches my attention especially is the fact that, you know, payers are really jumping in to help lead the way to increase this transparency and reducing costs not only for the health systems but also patients themselves. You know, talking about their out-of-pocket costs that go along with overuse with some of these Choosing Wisely efforts. My response really comes from kind of the viewpoint of care transformation leaders, knowing my background and day job, and also from patients who really, these are the two groups that really want and need to see this transparency to make these efforts better. And I have a few questions just related to both of those groups. So one, for those care transformation leaders or folks that are on the ground trying to, you know, take this data and do something with it internally, having data transparency that is valid, you know, really clinically meaningful and reliable is number one for them to get engagement locally, to build a culture change, you know, to leverage this data in the right ways. So you mentioned this on a couple slides, but I'd love to hear more about how your team really works to connect and kind of, you know, begin preparing or coaching these, you know, groups within the local centers that you work with, and especially knowing some of the limitations that you highlighted much earlier in the talk about, you know, this field of measuring overuse is such a new field and really developing nationally. So some of the nitty-gritty of these measures, there's a lot behind it to knowing, you know, what is truly clinical meaningful and what's valid in their local health system. So are the denominators appropriately defined? What are the benchmarks? And you know, sometimes the payer data, it provides that smoke of opportunity for improvement, but sometimes it is going down to the local chart review data in the medical record to understand how to define the fire that's causing it. And I'd love to just hear more about how your teams are approaching that complexity.
Absolutely. No, that is a great call out, and you know, really where we're having challenges and more conversation as well. So it really does start at the conversation with the different quality teams and accountable care organizations, and what's working for them, what's not working for them. So as we're moving forward, particularly within our hospital program, we're starting to explore more about how we can work in parallel from that data perspective. So continuing to be able to, as we need to from a population health management perspective, to be able to supply them with data, but being able to work hand in hand with the fact that they have that EMR level data that we don't have access to at this point. So aligning programs in such a way that they're able to utilize some of their data to help drive the programming with supplementation from us as well to make sure that we're all moving in the same direction. So that's where we're starting to move in that space. Sometimes when we are relying only upon our data for different programming, sometimes we get so caught up in conversations about the data that we're missing the whole perspective of improving the process along the way. So we want to make sure we're taking that burden out, but still being able to look to make sure we're moving in the right direction and supplementing with them with any data needs that they may have, since we're capturing people who may be jumping to different health systems along the way. But making sure that we're driving the programs in a meaningful way that's reliant on both sets of data.
Great. Yeah, no, and it's definitely a partnership because without that claims data, you're right, you can't follow them into other locations, right, without that information. You mentioned as well in your presentation that there's almost some, preparatory materials that you share with some of the local health centers that you're working with as they embark on this. Can you speak a little bit more to that?
Yeah, so as the program developed several years ago, they were able to develop some information. So able to develop information about some of the specifications. The provider community definitely wants to look at what are you measuring, how are you measuring, what are the codes, to be able to make sure it's really aligning with their programming. So that was one of the key components, and we've continued to put information out over the years in some of our newsletters to show a little bit more, to do a deeper dive, to go into some Choosing Wisely initiatives as well, where there may be some opportunities to be able to improve that we're seeing. So we've been able to construct different specifications, a provider manual that went into the program in more detail. And as we're transitioning into the health waste calculator, Milliman's been able to provide us with great information about how they're building their measures, what's important, why it's important as well. So as we continue to have conversations with the provider community, we're being transparent in measurement.
Wonderful. And do you have any examples of any health systems that have really, taken some of these, data transparency efforts, if it's through Milliman or through kind of the other work that have really excelled in, if you could pick one to share that story, that would be wonderful.
So I am relatively new to the organization, but prior to me joining, there was a lot of work that was done in the vitamin D space. So there were a lot of wins that happened there in relationship to the initiative. So able to build, again, information for both providers and members, that transparency in the data, and we're able to see significant improvements in the measure. I would say that from an individual provider system, there's one particular emergency department group that works within our system that we've been able to have great conversations about the data. They've taken that back and done a lot of deeper dives and implemented programming to help improve the measure to the point now where as whenever we present the data, they want to make sure that looking back, where do they continue to have opportunities because they've really targeted interventions. So as a plan, vitamin D has been a great area. On an individual basis, we do have a particular ED that's really embraced the data, looked down to the member level using their EMR data to be able to drive improvement.
That's great. I mean, it really sounds like the data is helping to begin culture change there. I just have one last question. When we talk about data transparency with these efforts, like we said, there's efforts that can reduce total cost of care related to some of this overuse, but the other part of that is also the out-of-pocket costs, right, for patients and improvement in that way. Has there been any movement, knowing that payers especially have access within their members to know what they're paying out of pocket for some of these things, to provide that data back, or is that something that is kind of on the horizon?
That is something that's on the horizon. So there's a lot of complexity from that perspective since there's so many variable products that we offer. There's variability in some of the contracts that are negotiated as well. There's a lot of data that goes behind that. But we're looking at, as we progress with our advances in our IT systems and our digital strategy, how we can continue to have more cost transparency for our members so that they're able to have more information in that space. So it's definitely an area that we're looking to improve on. We do have limitations with technology that we're continuing to try to work through. But one of our initiatives in moving forward is really how do we engage our members more in this conversation.
Great. Yeah, thank you so much.
Thank you.
Great, terrific. Well, this is Lisa, and with that, we're going to go to Daniel Wilson. Daniel?
Oh, thank you, and thank you, LouAnne. That was a great talk. I love the comprehensive approach. I love the education and the measurement, and so, congrats to Excellus. I liked it when you spoke about the local campaign being owned and led by physicians, and I was wondering what does that look like on the ground? How does, for instance, Excella, build trust? Trust is a important factor, an area that we're looking at from the Abim Foundation point of view. So how does that look like, that owned and led by physician at the local level, and how does Excellus, build trust with physicians on the ground?
That's a great question. So we can, we're a smaller health plan here in upstate New York, but the advantage of being smaller is that we're so embedded within our communities as well. So we do have internally a number of different chief medical officers, and there's two of us that work particularly in this Choosing Wisely Health Waste Calculator space. So Dr. Carnevale is my partner, CMO, so he works closely with our accountable care organizations and is really that physician resource, so we're able to have physician-to-physician level conversations with our ACOs to help drive that work. It's not us as administrators coming forward with the work. I work the same way within the hospital space as well, having some of those conversations with our hospital partners, for example, that emergency department, having those conversations. So I think the fact that we're coming from a clinical perspective and bringing that information from a clinical perspective back to the hospitals and to our ACOs, and having that sense of what it's like to work in that provider space, and having the conversations with our partners.
Great. So the Choosing Wisely campaign doesn't really focus on cost, and I wanted to know how that went over when you are emphasizing both quality and cost. How does that the cost issue go over with practicing physicians in the community?
So within the hospital groups, we haven't had a lot of that conversation. We've really framed it from the quality perspective and quality measurement and rate and percentiles. In the ACO setting, physicians are having more and more conversations around cost. They're interested in this space, and the numbers are really impactful and meaningful. Sometimes it's looking at $100,000 savings is a little bit different than jumping a percentile or jumping from the 50th to the 75th percentile. So there's something palpable about looking at it in terms of dollar values that has resonated with that community.
Great. So I love the Excellus as Choosing Wisely ambassador and community collaborator, very much like the role of Excellus as a provider of measures of overuse. But what does the communication look like between health plan and physicians? Another upstate gentleman, Howard Beckman, talks about those kind of conversations that you have after you present data. What does that conversation look like?
So within the ACO space, again, Dr. Carnevale has more of those direct conversations with our Aqua partners in regards to cost. We do bring a comprehensive team out to have those conversations. So again, Dr. Carnevale, we have clinical consultants who are RNs that are able to have that conversation, as well as some of the administrative support team that's there with the ACOs. And generally, I think the approach is to put the data on the table and start the conversation that way, learn a little bit more about the background and the context. Again, we take the perspective of we want to make sure that we're not pushing things on to people. We know from the insurance company perspective, there's a lot of that perspective of being pushed out, of being forced to do different things within the provider community, of being the one more thing that's leading to physician burnout as well. So we really try from our perspective here and aligned within our kind of our lifetime way Excellus culture of really seeing it as a partnership.
Within a group, do you show variation among the physicians, either blinded or unblinded? Is that a technique that you've used?
Yes. So we show provider level data to the ACO leadership to be able to take back and do that deeper dive.
Great. Thank you. Lisa?
Super. Well, thank you so much. Great questions, great discussion. We do have several questions, as I mentioned, in chat. So out of respect to those folks, I probably will start with those. So let's see here. There's several here. Would it be possible to get resources on the 6 top priorities that could provide CPT and ICD-9-10 codes that would help in establishing benchmarks?
So we did that within our priorities within Excellus. So Marla Miller and her team was able to pull some of those ICD-10 codes to be able to look at the different initiatives. So those 6 would be our priorities here in upstate New York. But I can definitely get back with the team and see if we can provide you with some more information about some of those specs so you have a sample of what those look like.
Super. Okay. And then sort of related to that, were the measures built by the Excellus team, or do you use a vendor to complete the analysis? I think you spoke to some of that with the discussion that might have been before you got to the Milliman part, but do you want to say anything else about that?
So initially the specifications were built internally by our team here at Excellus, but as we continue to get more involved in the space, wanted to learn more, do more in the space, we partnered with Milliman.
Yeah, great. Okay. I would say the other reference I would make to that is, and I think there were some references, but the Washington State Choosing Wisely Alliance that also has used Milliman and published their report, and I think they share some of the specs that they've used in their measures in that as well. So I think that's kind of the best listing I've seen of the specifications for some of these measures. So then what is the best recommendation you have to integrate these recommendations directly into the physician's daily workflow?
I think the importance of involving those physicians into understanding the program and some of the why. So I think incorporating your frontline folks that are seeing the patients into the improvement projects around this is really key. So as we think about moving the antibiotic work forward, we're going to ensure that we're working with those teams and really engaging the front line and incorporating that in. And the great thing about the antibiotic space, for example, the antibiotic stewardship guidelines from the CDC really take that to heart, and it's some key components of implementing an antibiotic stewardship program is really that investment. So I think helping people to understand the why, helping them to be a part of the work, will help them to incorporate it into their workflows.
Great, thanks. And I think that was it on the questions, but we are certainly happy to open up the mics, and people can unmute themselves. Just mouse over your, I believe, Kelly, correct? People can unmute themselves on this one.
Yes, I've mostly unmuted everyone unless there was a little bit of noise, and then I remuted a few people, but mostly people are unmuted. And if you do see your microphone is red, just click on it and it'll unmute.
Great, thank you. So other questions from anyone on the session? Well, I'll jump in with one while we're doing this. So clearly you have done an amazing amount as a health plan, LouAnne, to do this. There are a lot of health plans around the country, and I think some are using Choosing Wisely, and many, not so much. What was it, do you think, that drove you as a plan to really latch on and do this degree of work around this?
I think it started with my predecessor, Dr. Matt Bartels, who really embraced the idea of choosing wisely. And I think it was a number of things. So where we sit in the organization of CMOs is we're responsible for our quality measurement program. So we want to make sure that we're meeting all of our key quality measurements. So there's so many initiatives that tie that quality and cost component together that it's a natural synergy. If you're working and choosing wisely, a lot of these these measures in choosing wisely also touch our HEDIS measures as well. So you're moving that work forward in quality, and you're going to see a measurable impact in your quality performance, which is how our funding is tied. So it's a natural synergy from that perspective. I think the idea of it being a shared decision-making tool, so it's providers and members coming together. So, two of the different groups that we serve our providers, we serve our members. We're able to bring that together in hopes of improving our quality measures as well. So there was a lot of alignment with the work that we do, and he really helped to drive that forward.
Great. Okay. And then I've got one more. Let's see here. When sharing the data with groups and their individual doctors, how are small denominators taken into account?
That's a great call out. So I think it goes back to that data transparency component. So we're able to show both the numerator denominator as well as the rate and the dollar value tied to that. So it's clear what kind of denominators that we're talking. Within our hospital performance incentive program, we call that out as well. And when there's a really low denominator, it's generally a measure that is not included into the programming. We definitely give them their information, their data, but it's so hard to work within that space.
Yeah, okay, great. All right, well, I think we are sadly here at the end of the hour. Kelly, thank you for chatting the link to the Milliman calculator report, to the Washington State report that used the Milliman tool as well. And I think I need to thank you all again for joining, and so much LouAnne Giangreco and our reactors. But turn it back to Kelly Rand now.
Thank you. I want to echo Lisa's gratitude and also thank her for the wonderful job moderating, but wonderful presentation, terrific reactions, and again, we'll be sharing the recording on Workplace. If you're not on Workplace, you may also email me to receive a link of the recording. And thank you again, everyone, for attending today, and we'll talk to you all next month.
Great. Thank you all.
Thank you.